Hello and welcome to Introduction to Oral Health. My name is Bethany Seidnitzer.
And my name is Mary Cruz Perez Valenzuela.
And we're just going to be talking about general oral health in this lesson plan today.
So first off, thank you so much for participating in our research model. The purpose of this research model is to study the association between dialysis treatment and oral health. All of the information collected from the surveys will remain confidential. The program will consist of 4 virtual lesson plans and 2 surveys per lesson. One before the lesson is delivered and one after. While personal information, such as your name or address, will not be collected, the surveys may include questions regarding demographics. The surveys will be collected from a third party once completed to further ensure that your identity remains anonymous. Participation in this study model is completely voluntary, and the participant may withdraw at any time. Your completion of the survey will be considered your consent to use the information provided for our research model. Thank you. So before we get started, here are the objectives for today's lesson. By the end of today's lesson, you should be able to differentiate between stain, dental plaque, and calculus. You should know the definitions of periodontal health, gingivitis, and periodontitis. You should be able to recognize the signs of a healthy mouth. You should be able to state what you can do to help prevent the development of periodontal disease or gum disease. You should be able to identify signs of periodontal disease, and you should be able to define how often you should visit the dentist.
So just to start our lesson off, we just wanted to give you an example of what a standard healthy mouth looks like. In this picture you can see a healthy male. He's got nice white teeth, which we don't expect everybody to have white teeth like this, but we're just going to show you examples of different things to look out for: stain, plaque, and calculus, which we'll get right into. So here we have examples of stain, and you can see by 2 pictures we have examples of 2 different types of stain. We have internal and external, and I just want to give you a few minutes to look at both of the pictures and see if you see any differences. So on the left side here we have internal, and you can see by the different layers of brown and yellow that this is very obvious to the eye. You can see shininess on the outside, and that's the main reason, the main way that you can see that this is an internal stain, meaning it's inside the tooth. You cannot remove it by brushing and flossing, and we cannot remove it by cleaning your teeth. This is something that you have to bleach or whiten your teeth in order to get rid of. On the right side here, this is called external stain, which is just a stain on the outside of your tooth that you can get rid of by brushing and by going and to the dentist or dental hygienist and getting it cleaned off. While internal stain is not very appealing to the eye, it is not going to cause you any problems. External stain, however, can increase your retentive ability, meaning that it may make it easier for bacteria to stick to your tooth, which can cause issues down the line. Plaque is a sticky film of bacteria that likes to stay on your tooth, and there's many different layers of this, but this is the stuff that you might feel on your teeth if you haven't brushed or flossed for a few days, or if you've eaten a lot of sugary foods. It is easily removed when you brush and floss, as you can see in the pictures up here. You have very healthy teeth, healthy looking teeth up here, and then when we dye it with a solution called disclosing solution, it basically dyes the bacteria purple on your teeth. So you can see different areas where this person has missed brushing or flossing, up top and bottom, and you can see how easy it is. From the left he looks very clean. But from the right, you can see there's a bunch of different areas that he has missed, and it's very easy to miss those areas. Lastly, we have calculus, or a lot of people know it as tartar. This is the accumulation of plaque as it hardens. So the stuff that we just talked about in the last slide, that soft stuff, if it stays on your tooth for too long, it will harden and become calculus. This stuff cannot be removed by brushing. This stuff has to be removed by a professional, a dentist, a dental hygienist. And if this stuff stays on your tooth, this is also something that helps the bacteria in your mouth stick to your tooth, and it can cause or may lead to bone loss if not removed.
So before we continue, I just want to go over the term periodontium with you. Periodontium. So basically, this includes your gums, your teeth, your bones, basically anything that helps keep your teeth in place. So we have a picture in the middle here of basically everything that the periodontium consists of. All right, so we have the tooth. The tooth is embedded into the bone. All of this brown that you see here, the grainy, is your bone. So when we talk about bone loss, that is basically when this bone starts to move down and down and down from infection or the calculus that's present. The gums, we call the gingiva, but everybody knows it as gums. That's this pink section right here. And then we have the tooth. The tooth has the pulp, the dentin, and the enamel. The enamel is the outside that you see. It's basically the hardest part. So, with the gums, whenever we talk about biofilm and bacteria, that's basically all of the bacteria is getting stuck right here, where you can see that little like cave-like section. When you don't disrupt or when you don't clean around the tooth very well, all of that bacteria starts getting into this little pocket right here, and it basically just lives there and grows and grows and grows and causes other problems, which is the bone loss that we were talking about and inflammation. So to either side here, we have pictures of healthy mouths, just so that you can get a standard. Basically, periodontal health, all right, so health of your mouth consists of gums that are nice and tight around your tooth. You don't want to see any bleeding when you're brushing or flossing, and you don't want to see any bone loss. So basically, you're going to have nice pink and flat gums. When you start to see more of a red color, even reddish purplish, or bleeding, then those are signs of infection. So whenever you don't have periodontal health or oral health, the other thing that you might have is gum disease. Gum disease basically can be divided into two sections: gingivitis or periodontitis. So before I continue, I'm just going to give you a couple of seconds to think about what you might think the difference between gingivitis and periodontitis is. So now that you had a little bit of time to think about that, we're going to start with gingivitis. So gingivitis is basically an infection of your gums. So as we talked about before, you can see in this picture right here, this is healthy. The gums are nice and pink and fully surrounding the tooth. Whereas in this picture, the gums are more red and swollen. So they're kind of like angry looking. And that's from the bacteria that's causing this infection. You can see the same thing over here. Healthy gums, very nice and pink. The unhealthy or infected gums are more red and swollen. And in this picture in the center, you can really see what that looks like in real life. So you can see the reddening and inflammation not nice and flat how we talked about in previous pictures. And as you can see, what's present here is biofilm, which is what Bethany already went over. That biofilm is holding on to bacteria that's causing inflammation, and basically your body is trying to reject it. So that's why it starts to look like this. It's important to distinguish between gingivitis and periodontitis. With gingivitis, like we said, this only includes your gums. We're not seeing any bone loss yet. Once you start to see bone loss, then we'll see periodontitis, which is what we're going to talk about next. Okay, so periodontitis. With periodontitis, you're going to see gum swelling like you do with gingivitis. You're going to see bleeding when you brush and floss. But the difference here is that you're also going to have bone loss. So on this cartoon picture here, we can see that on one side we have health, where we have the gums nice and pink, and the bone level is nice and high to the tooth. Whereas on the other side, we see here where we have an infected site. The inflammation is causing the reddening, but now we also have breaking down of the bone. And as you can imagine, with this bone breaking down, the tooth starts to become more mobile, so it can start to feel wiggly. It's basically just not as nice and tight into your gums and into your bone because it doesn't have that bone to keep it in place. In the center here, you see an image of someone with periodontitis. They have pretty severe bone loss. This right here is the root of the tooth, which should not be visible to the naked eye, but you can see it here. This right here is the crown of the tooth, which normally that's the only part you want to see. And as you can see, all in between, we have a lot of that biofilm and calculus that is just getting stuck there and causing further infection. So that's basically the difference between periodontitis and gingivitis.
So what causes periodontal disease? How do we start seeing these signs of infection in our patients? Well, first off, you have to have that plaque accumulation. So that sticky stuff we were talking about earlier, the stuff that you can remove with your toothbrush, that is made up of bacteria, good bacteria, bad bacteria, and it accumulates in your mouth. As that bacteria stays in your mouth, more of that bad bacteria that's not already in your mouth starts to grow. This bad bacteria causes your body to promote an immune response. So basically it says there's a foreign body in here, we don't want him here, so we're going to attack it head on. Unfortunately, your body sends mediators to come and kill this bacteria, and they release toxins that hurt not only the bacteria but the rest of your body. So that's what we see when we see your gums with this nice, not nice, red inflamed area. You know, they're puffy, they're red, they're basically angry at you. That is your body's immune system trying to kill off the bacteria. The problem is, because your immune system is releasing those toxins, it's also causing your gums and your bone to basically break down, to deteriorate. And if you do not remove it or get it removed by a professional, then this will continue to happen. So the breakdown is just going to keep going until this stuff is removed. Like we said earlier, if you don't remove this plaque, it gets hard, and then more bacteria stick to that hard surface. And if it doesn't come off, your body is going to continue to try and fight it off, and your bone, your gums, it's going to keep breaking down until eventually your tooth falls out. So we want to prevent this by removing that sticky stuff. So just as a recap, here are some more pictures of the different stages from health to gingivitis to periodontitis. So when we were talking about bone loss earlier, this is what we mean. We all know that it is very important for us to take x-rays whenever you go to the dentist. It's a really good idea to get those at least, every few years. A lot of dental offices do every once a year just to have comparisons. And this is really good for detecting if you have bone loss or if you have cavities or anything like that. And on these x-rays, you can actually see calculus too. If you see these little thorns right here, they look like little thorn buds on the roots. I'm sorry, my pointer was not working. Right around here on the right picture, you have these little thorns on the roots of your teeth. That's calculus. So on the left side, we have healthy gums and gingivitis. You're not going to see any bone loss. So we have this granulated bone down here. This is what your teeth sit in. This is your jawbone. You can see that it is nice and healthy. It is all the way up to the tippy tops of the roots. Those are good. On the right side, we have bone loss, and you can see, especially on this tooth right here, how the bone is all the way up here. So that means that bacteria have gotten down in here and have eaten away at the bone. And yes. And then just examples of what it's going to look like on the outside. You have healthy gums on the far left, and then gingivitis on the middle left. And you see the red areas of your gums. That's the start of the infection. And then you have what periodontitis looks like on the outside. And sometimes, in some cases, you won't even be able to tell that you have bone loss from the outside. Sometimes it looks like this on the left side. It looks just like gingivitis, but you can have bone loss. So that's why it's very important to have x-rays done. So some other signs that you may have a periodontal disease, meaning if you have gingivitis or if you have periodontitis, any of those infections. It could be if you have chronic bad breath. So if somebody's offering you a mint, be wary. If you have a painful experience when you're brushing and flossing, if your gums are tender or they hurt, if you have any pus, if you've ever had an infection, you know what pus looks like. It's that white stuff that, comes out, is nasty. Pus coming out in between your tooth and your gums, that is a sign of infection. If you have any loss of teeth, or if your teeth are loose when you're when you're eating, sorry. If you have pain when chewing, if you have receding gums, so basically that means if your gums are moving away from your tooth, you're going to start seeing more of your teeth in your mouth, whereas your gums are just slowly going down. Or if you have exposed root surfaces, and in the previous picture we showed you of periodontitis, that's where you can again see more of the tooth. It almost looks like your teeth are getting longer, and that's because you've lost bone, you've most likely lost gums in that area. Risk factors to look out for that may cause you to have a periodontal disease are, first and foremost, if you have a systemic disease, which is something that you're already dealing with right now, being on dialysis, which we will go more into in another lesson plan. Another is smoking and chewing tobacco products is a huge risk factor. If you have dry mouth, that's another one. If you have poor nutrition, this includes vitamin C. So poor nutrition, basically, if you're eating a lot of foods high in sugar and carbohydrates, so all of the things that taste good, chips and sodas and candies and everything like that. And then number one risk factor is poor oral hygiene habits. So not brushing and flossing and not cleaning in between your teeth. If that plaque is allowed to sit on your teeth, it can cause problems, and it will cause an inflammatory response. So we need to remove it. For tips to maintain a healthy mouth, First off, you need to be seeing your dentist or your dental hygienist at least once a year for checkups, cleanings, and oral cancer screenings. This is going to help prevent you from not seeing things that you can't see. You go to a professional so they can diagnose and they can help treat what you don't know. X-rays are an important part of diagnosing and treatment. So like we showed you before, we use X-rays to find out if you have a cavity or if you have bone loss. If you are diagnosed with a periodontal disease, periodontitis, which is you have bone loss, then you may need to be seen every 3 or 4 months just to make sure. We talked about the different bacteria in your mouth. The tough, hard, dangerous bacteria that cause periodontitis is not going away. Unfortunately, we have no cure right now for periodontitis, so the only thing we can do is prevent it from getting worse. And that's why it's usually recommended you come see a dentist every 3 or 4 months. Other tips, brushing at least twice daily. So that's usually average. We say at least once a day, but 2 times is really good. You don't really need to be brushing 3 or 4 times a day. We do recommend you use a floss or floss picks or something in between your teeth to really disrupt that bacteria. And you want to floss before you brush. You want to disrupt that bacteria before you wash it away, okay? It also does help if you're using a mouthwash, antimicrobial mouthwash, and you use that after you brush, and that will help kill the bacteria. A hint that we will talk more about later is do not use mouthwash for 30 minutes after brushing, and again we'll go into that later. And the final tip, clean between your teeth. We had already talked about this with string floss, a water flosser, or with a small brush to disrupt that bacteria. Thank you guys so much for watching. We hope you enjoyed this tutorial, but it's not over yet. We have one more survey for you to take to complete this course. We hope you continue with us over the next few weeks, as we do have 3 more presentations to go. If you have any questions about today's presentation, you can leave a comment in the post-test questionnaire in the additional comments section, and we can answer them at the next tutorial. Also in this section, if you want to just please let us know how we did, that would be great. Thank you so much, and we'll see you next time.
Thank you.